Well, the XBB1.5 is really interesting because it's the daughter of a mixture of different viruses that have been circulating in humans in the last few months. So it's actually what we call recombinant, and it's had another couple of mutations added on top of it. And the reason it's interesting is because it's acquired a mutation that both enhances its ability to avoid the immune system, but also to latch on more tightly to ACE2, which is the receptor on our lung cells and our cells in our nose and throat that allows infection. The identification of XBB1.5 is complicated by the fact that sequencing worldwide has dropped very, very markedly. So it's really hard to know where this virus actually emerged, in which country it was formed. All we can say is that it was detected in a number of different countries around the same period of time. Well, I think that the idea of transmissibility is something that is dynamic. It changes over time, depending on what else is around. And this one, this variant seems to be taking over from the previous ones, and looking at the mutation profile, we can see why. But I'm not necessarily worried about this, because of course this is what will happen in terms of the virus. And as long as we are well protected with vaccines, then there shouldn't be a problem. In 2022, we saw a new vaccine with two different variants in, and that has been shown recently to provide very good protection from hospitalization and severe disease. So we believe that the vaccines we're using are going to be highly effective against severe disease, as long as we're up to date on our boosters. Well, I think that the XBB1.5 really is a good reminder that the virus is still changing. It's still doing things to avoid our immune systems and vaccines, and it's still doing things to make itself more transmissible, and that's what you'd expect from an evolutionary process. And it just reminds us that really we do need to keep on top of our vaccination uptake, in other words, reaching vulnerable populations such as the elderly and those who are immune suppressed, as well as younger individuals with health conditions. And also just remembering that masking is a highly effective way of preventing infection in crowded spaces, and during winter I believe that we should be maintaining such practices as we go forward, and these are practices that are very common in Eastern countries. Well, we know now that new variants are generated in individual people over periods of months and even years of evolution, and these individuals usually have an immune system that can't deal with and can't clear the infection. So the probability of that happening has markedly increased with the number of infections happening in China, where there are likely to be significant numbers of immune suppressed individuals. So it's just increasing the probability that we're going to see new variants emerging and spreading. So that's the concern really with what's happening in China. So the development of this pandemic has been very interesting. We didn't realize that new variants were going to emerge as quickly as they did, because we didn't appreciate long-term infections within individuals leading to lots of mutations and new viruses. We now know that's a reality, and therefore we are in a situation where new variants are continually replacing each other. What's happened recently, though, is surprising, because Omicron was predicted to be just the next variant in the process, but we haven't really seen a radically new one since November last year. And that's interesting because it shows us that Omicron has achieved a complex set of mutations that have achieved a really high level goal. They've achieved very high levels of transmissibility and immune evasiveness, and it's going to be difficult for a totally new virus to replicate or improve on that combination of mutations. So we may be in a new chapter in the evolution of this virus. I believe that coronavirus, or SARS-CoV-2, is here to stay. It may become one of the seasonal coronaviruses over time. It's difficult to tell, and whether we will need ongoing vaccination is also another thing that we need to address. It may become like influenza, where we do need yearly updates or updates every few years, because the virus is changing so much that we don't want to become vulnerable to severe disease.